We also want to recognize that we've covered 3 screening tools, and we're going to demonstrate these tools in paper form. But we want to affirm and recognize that Mark and I have worked with many partners throughout Chittenden County and the UVM Health Network, and many folks have scaffolded in these screening tools into the electronic health record. Now, there's a benefit to doing that because I think ease of administration comes into play in those moments. Also, from a data perspective, we could begin to look at trends across time, and we could begin to identify panels to support. So we strongly encourage you to talk with your EHR vendor about integrating these screening tools into your electronic health record. We believe that tracking the use of these screening tools over time will support best practice care for patients experiencing suicide risk.